Actually, today topic is assigned to me by HOD Medicine. This is a very small topic. It will take 3-4 lecture, and this is concerned to especially common anesthetics and anesthesia in dogs. Already, you people know about some basic idea about this anesthesia in general surgery, general anesthesiology, courses of VSR 411. But again, I will revive your knowledge and I will discuss all the things here. First of all, introduction. As you know, there is no safe anesthetics. Every anesthetics is having some side effects. And as per the situation of the patient, we used to select that anesthetic which is safe for that particular animal. So there is no safe anesthetic agents and there is no safe anesthetic procedures. No anesthetic procedure, even intravenous anesthesia, inhalant anesthesia, regional anesthesia, every anesthetics techniques is having some advantages and disadvantages. So there is no anesthetics, though no safe anesthetics, and no safe anesthetic procedure. Only safe thing is anesthetics, and it totally depends upon skilled anesthetic. If perfect skilled anesthetic is there, then he will manage the case accordingly. So the person who is engaged in this procedure plays very important role. So general consideration, as you know, anesthesia, and for wild animals it is known as chemical restraint. It is a reversible process. Many anesthesia is having reversal for that to reverse the effect of that particular anesthetics. The purpose of anesthesia is to produce convenient, safe, effective, and inexpensive means of chemical restraints. So whatever anesthesia you are using, it should be less expensive and it should have reversal agent. That will be good. So that medical or surgical procedure, and it is mainly involved for the restraining and to perform surgery in case of animals with minimal stress, pain, discomfort, and toxic side effects. If anesthetics should have minimal stress, avoid pain and discomfort, and it has least toxic effect. So criteria of this selection of these anesthetic drugs depends upon, as you know, species, breed, age, and relative size of the patients. If fatty animals is there, then your selection will be slightly little bit others. And selection of different anesthetics will depend upon breed, age, and species also. So you should think about these also while considering about the anesthesia. Then physical status and specific disease process of the patients. That's why we used to recommend blood test, kidney function test, liver test, all this time before giving any anesthesia, so that we should know about the status of the liver, kidney, heart, all these things. So physical status and specific disease process of the patient should be every time should be considered before going for any anesthetic procedure. Concurrent medication, history of the patient, severity of the pain, personal knowledge and experience, availability of training and assistance. These all things are points which you have to consider before administration of any anesthesia. Now, these are some definitions already you know. Acupuncture, acu means needle, puncture means needle puncture. This is a method of the Chinese method for triggering points of acupoints, and by this we can have some analgesia of different reasons. Suppose you are interested for anesthesia of hind limb, then analgesia of hind limb, then a particular acupoint is there, and this is Chinese method. So acute means needle, puncture means needle. This is the method by piercing needle to that particular acupoints. Agonist, you know, drug that produces an effect by interacting with specific receptors, that is known as agonist, and you know, opioid agonist is well known. Now echinacea means loss of motor response, usually caused by blockade of motor nerves. Definition are these definitions are important. Allodynia, analgesia, you know, this is loss of sensitivity to pain is known as analgesia. Hypoalgesia is less pain, and hyperalgesia is exacerbated pain. So these things you have to consider. Then these are the different phases of the anesthesia, which you have to remember this thing. This is most important thing. Phases of anesthesia is important. Please note down, because many times people used to ask that what are different phases of the anesthesia. So pre-anesthetic or pre-induction period, then induction of anesthesia, and after that maintenance. Maintenance of anesthesia, either you can maintain this by IV intravenous anesthetics, either you can manage by maintain anesthesia by inhalant anesthetic. Different procedures depends upon the condition of the animal and surgical procedure you are going to perform. Then next one is recovery, and then post anesthetic. But these five different phases of anesthesia are very important to remember. Now local anesthesia, this type of anesthesia is limited to some local part. Suppose you are interested for this teeth surgery, then you are interested to desensitize particular teeth, then this is known as local anesthesia. Regional anesthesia, this regional anesthesia is paravertebral nerve block. Paravertebral nerve block is type of regional anesthesia. General anesthesia, general anesthesia is loss of sensation. It includes sedation, hyporeflexia, analgesia, and muscle relaxation. These are the different components of the general anesthesia, which we have to achieve by either by combination of two drugs or more than two drugs. So surgical anesthesia means loss of consciousness and sensation accompanied by sufficient muscle relaxation and analgesia. Without muscle relaxation and analgesia, it is impossible to perform that type of surgery. Now next one is balanced anesthesia. As name indicates, balanced anesthesia means what? Balanced anesthesia, these are the three components: sedation, analgesia, and muscle relaxation. These are the three components. If you are going to achieve all these three components either by two drugs or more than two drugs, already I have discussed, and this is known as combination of two drugs or more than two drugs. This is known as multi-drug approach. And by this multi-drug approach, if you are going to achieve all these three components, sedation, analgesia, and muscle relaxation, then this is known as balanced anesthesia. Nowadays, people used to follow this combination only so that we can perform surgery in efficient way. Suppose you are having an anesthetic combination which is not having good muscle relaxation, then it is not possible to perform orthopedic surgery, even abdominal surgery in many times. So you have to consider all these three components while going for any anesthetic procedure. Now dissociative anesthesia, dissociative anesthesia, important thing is this dissociative anesthesia is catalepsy, analgesia, and altered consciousness. You remember all these things. Catalepsy is most important thing, and ketamine and teletamine is dissociative anesthetics, which is used for this dissociative anesthesia. So whenever definition will be asked in exam, dissociative anesthesia, then you remember all these things: this catalepsy, analgesia, and altered consciousness. My minimum alveolar concentration. This value is very important, and this is mainly concerned to inhalant anesthetics required to prevent movement in response to noxious stimuli in 50% of anesthetized patients, just like LD50, LD50, ED50 in pharma. So MAC value is important for inhalant anesthesia. Now antagonist, catalepsy, I have already discussed. Antagonist, a drug that occupy a receptor site but produces minimum or no effect, that is known as antagonist. And catalepsy, it is most commonly noticed during dissociative anesthetics. At the time of injection of dissociative anesthetic, it is a state in which malleable rigidity, stiffness of the limb is there, and the patient is generally unresponsive to oral, visual, and minor painful stimuli. So malleable rigidity is very important for this catalepsy condition. So you remember these things. Now hyperalgesia, already I have discussed. Sedation, hypnosis, narcosis, and neuroleptalgia. This is very important. Hyperalgesia, already I have discussed. This is increased or exaggerated response to stimulus that is normally painful. So this is known as hyperalgesia. Whenever you will touch an animal, it will show exaggerated response. This type of response is known as hyperalgesia. Now sedation, definition of sedation, you have to remember. Always people used to ask What is this sedation? Sedation is CNS depression in which the patient is awake but calm. Means patient jaga hua hai but शांत है. And this term is used interchangeably with tranquilization. In tranquilization, this is with sufficient stimuli, the patient may be aroused. If you are going to give sufficient stimuli, suppose you are going to pin prick or any type of pain stimuli the animal, then animal will arouse. This is the condition you have to remember. Now, another next one is hypnosis. This is artificially induced sleep or trance-resemble sleep from which the patient can be aroused from sufficient stimulus, just like tranquilization. Narcosis is drug-induced stupor or sedation with or without hypnosis. Means it is plus including this hypnosis or without hypnosis. So definition is very important. And now another term comes neuroleptic analgesia. This is hypnosis and analgesia produced by a combination of neuroleptic drugs and analgesic drugs. You remember, neuroleptic drugs, suppose example for this neuroleptic analgesia is fentanyl droperidol. Fentanyl is opioid and droperidol is neuroleptic drugs. So tranquilizer. So these type of many combination is there in the, this neuroleptic analgesia, but important with this one is fentanyl droperidol is a good one. So you remember this combination for this anesthesia. Now these are the some definitions which you remember. Just read it. And now important things is why, what is the use of these anesthetics? Where we used to give anesthesia? Why this is required in veterinary profession? So sometimes what happens, suppose you are interested for ultrasonography, radiography, MRI and other things, and then animal is not cooperative many times. So for this type of examination, you used to select this anesthetic combination just for restraining purposes. Cleaning, grooming, and dental prophylaxis. Dental scaling is not possible without this general anesthesia in case of canines. In case of large animals, we can go for this simple nerve block. Even in human beings also, tooth extraction is possible by this giving this nerve block for vital, mental, whatever nerve teeth we are interested to remove. Then for biopsy, radiation therapy, bandaging, splint, and cast of application. Sometimes this procedure also require this restraining, and this restraining needs anesthesia and sedation. Then capture of exotic and wild animals. You know, without this chemical restraints, it's many times not possible to capture. Physical restraint is also effective for the capture of these exotic and wild animals, but many times we used to select these different drugs like gelatin, ketamine, even detomidine, medetomidine for the capture of exotic and wild animals. Then the next one is transportation. Transportation also needs many times some sedative drugs. So these are the some use of anesthetics. Then manipulation, catheterization, wound care, and obstetrics. Obstetrics, you know, if you are going for this fetal removal many times, and epidural anesthesia, this type of local regional anesthesia, posterior epidural anesthesia is required. For rectal tenesmus, it is also required. So this type of manipulation also needs this use of anesthetics. Then anesthesia for many surgical procedures. Control of convulsions. Control of convulsions is also needs this anesthesia like phenothiazine derivatives. Diazepam. Diazepam is used for drug of choice for the status epilepticus just to control epilepsy. Even phenobarbital. Phenobarbital is used for the control of this conversion. And next one is euthanasia. Sometimes mercy killing is also required for the animals which cannot be. This is just like just an example of painless death. Suppose animals is having a problem which animals cannot recover. So many times we used to recommend for euthanasia. Now these are the different types of anesthesia and route of administration, different combination. But many times whatever procedure we used to perform is infiltration, inhalation, intramuscular, epidural, intravenous, topical, and transdermal. Whatever star point is there, these are the different methods we used to perform and give by this route in case of our veterinary profession. Now, patient evaluation is very important. Already I have discussed history, physical examination, and condition of the animals, and about airway patency, whether animal is having any airway obstruction or any airway difficulty. So you have to monitor these things very carefully. And risk of the patients, how what is the disease condition of the patients, and anticipate likely untoward effect based on the history and physical status. Based on this history and physical, why physical status and history is important? Because already I have discussed this. Every anesthetic is having some side effects, so you have to note down all this history and all the about the physical status of the animal, whether animal is obese or whether animal is lean and thin. These two different conditions require different type of anesthetics and anesthesia. And an emergency card with appropriate antidote and antagonist should be maintained before going, if possible. If possible, if you are having antagonist for that particular whatever anesthetics you are using, you keep that particular antidote at the time of administration of anesthesia. Now, patient evaluation. Already I have discussed species, breed, age, sex, body weight is very important, because you are always, we used to give administered anesthesia on the basis of body weight. So these things we have to note down before administration of anesthesia. Then severity of illness, duration and severity of illness. Suppose if animal is having fracture, animal is having intestinal obstruction, then you have to select the history that since how many days your animal, your pet, your animal is having this disease. Concurrent symptoms of the disease: diarrhea, vomiting, hemorrhage, seizures. Suppose animal is having seizure and you are planning to administer ketamine, then what will happen? Ketamine increase the threshold, decrease the threshold load, and whenever animal is having a history of seizure and you are going to administer that ketamine, then what will happen at the time of surgery? You will notice recurrent epileptic seizure is there. So it will be very much problematic. So that's why history about renal tolerance, about cough, about exercise tolerance, all this history you have to record before administering this anesthetic. And recent feeding, whenever you are going to give anesthetics, you used to keep small animal. In case of a small animal, you used to keep at least for outfit for 6 hours. But in case of large animals, it is 12 to 18 hours. But in case of large animals, suppose ruminants, its outfit should not be more than 24 hours. So these are some criteria which you have to consider before administration of the different anesthetics. Now, different body condition, different system you have to observe. Already I have discussed cardiovascular, pulmonary, hepatic, LFT, liver function test, kidney function test we used to perform. Then nervous system examination and history is regarding this nervous. If any animal is having any nervous system problem, then you have to select history, and on the basis of this, you have to proceed for anesthetic administration. So different examination of this different systems is very important. Cardio, what is the status of heart rate, rhythm, arterial blood pressure? What is pulse pressure quality? What is the how is animal is showing this capillary CRT, capillary refill time? You auscultate the heart for any type of cardiac murmurs. So these type of things you have to monitor before administration of anesthesia. Now, pulmonary, respiratory rate, depth and effort of the respiration is also very important, and you should know about the heart rate of animals which you are going to for which you are going to administer this anesthesia. Tidal volume, if possible, you can note down. Cyanosis, whether cyanosis is Lewis coloration of the mucosa. So these things you have to record very carefully. Now, metabolic and endocrine. That's why we used to perform all these blood parameters: CBC, LFT, KFT, T3, T4, TSH, all these parameters, so that by knowing all these things, your anesthesia and maintenance of anesthesia and your selection of anesthesia will be very important by knowing all these parameters. Definitely, electrolyte imbalances should also be recorded, like hypokalemia, hypocalcemia, hyponatremia, hyperphosphatemia, all these things. Now, local anesthetics. Local anesthetics, classification of local anesthetics depends upon different type of things, like um, structural, on the basis of structure of that particular local anesthetics, on the basis of duration of action, like all short acting, long acting, ultra short acting. So this is not mentioned here, but on the basis of uh, this duration of action, you please uh, note down from your pharma notes or a pharma book. And these are some classification. This is ester-linked drugs. This is just to remember the name of these drugs. Ester-linked drugs are procaine, tetracaine, benzocaine, all the things, because these course needs some basic information about this uh, anesthetics. So just you remember the basic classification on the basis of ester-linked local anesthetics are procaine, tetracaine, benzocaine, and amide-linked anesthetics most commonly we used to have here in our clinics, our routine practice, lidocaine, lignocaine. So you have to remember at least the name of these things and these anesthetics. In continuation, that is amide link, mepivacaine, bupivacaine. These are the different anesthetics. And some topical anesthetics is also very important. Suppose you are going for catheterization of urethra in case of male dog or in case of female bitch. So at least you should remember the name of the topical anesthetics which you have to. Many times you have to recommend these topical anesthetics, and by using these topical anesthetics, it is very easy to go for the without pain. You can go for this anesthesia, topical anesthesia, like administration of catheterization will be easy, and after removal of this catheter, animal will not show any type of pain. So at least you should remember and at least you should remember the name of the topical anesthetics, like bupivacaine, tetracaine. Tetracaine is most commonly used in case of eye or some minor surgical intervention on the eye. Ibuprofen, proparacaine. Proparacaine is also used, most commonly used for ophthalmic topical anesthesia. Just remember, this is very important, proparacaine and tetracaine. Now, local anesthetic drugs and local and occasionally systemic vasodilator, except cocaine. These are some important points regarding cocaine. Local anesthetic drugs are always local and occasionally systemic vasodilator, except cocaine. Cocaine is having some vasoconstrictive property. Some toxicity is also related to this local anesthetics, and this you have to remember this seizure. Seizure is many times noticed in case of by application of this lignocaine. Hypotension is also noticed. Arrhythmia, apnea, methemoglobinemia is most commonly related to this benzocaine and prilocaine, and many times allergic reaction is also noticed. So these things, at least you should, people used to ask that what are the different toxicity you may notice after administration of this local or topical anesthetics. So at least you should remember this. These are important points only. Suppose I have mentioned here different classification, but at least you should know about the different broad classification. Ester-linked lignocaine are this, and amide-linked lignocaine are this. Topical anesthetics are this. So these are the some basic things which you have to remember for your further exam and even for your further routine practice. Now, comes to pre-medication. This is very important. And already I have discussed that pre-medication is very important. What is the role of this pre-medication? Because it reduces fear and calm of the patients. It reduces distress during the scanning and minor manipulation like placement of catheter. I have already discussed the placement of catheter, even topical anesthetics also, or even this medication. This pre-medication is divided into different groups. I will discuss later, but the basic aims of our pre-medication is this. Just to produce pre, intra, and post-operative analgesia. This is pre. If you are going to administer dialysate before administration of main anesthetic, that is known as preemptive analgesia. So, and for post-operative analgesia, most commonly we used to give these opioids. So So these are the different applications and objective for administration of this pre-medication drugs. And one important thing is also to reduce salivary and airway secretion, so that after administration of main anesthetics, it reduces the secretion, and sometimes if laryngeal reflex is abolished and if your secretion is there, then what will happen? It will enter in the trachea and it may produce respiratory distress. So during to prevent this respiratory distress, we used to give this pre-medicaments to decrease the total quantity and amount of major anesthetic drugs. And this is known as to decrease the total quantity or amount of the major anesthetic drugs. Means suppose your total amount of a main anesthetic drug is 10 mg, and if you have given pre-medicaments before that, then what will happen? The total dose will decrease up to 5 to 6 or 7 mg. So already I have discussed that every anesthetic is having many deleterious effects. So by using these pre-medicaments, we are going to reduce the chances of side effects of the main anesthetics to the normal physiology or cardiovascular, pulmonary, and all this system. To reduce the intraoperative and operative fluid like vomition and regurgitation, these are. And this is the classification of the different anesthetics, which you have to remember. This is very important. At least you should know these: the anticholinergic, tranquilizer and neuroleptics, butyrophenone, benzodiazepines, sedatives, opioids. These are the 4 basic classification, and example of these anticholinergics are given here. Tranquilizers, neuroleptics, phenothiazine are given here. So at least you should remember this classification, and this is very important. Many times people used to ask, then anticholinergic drugs कौन सी होती है, sedative में कौन सी आती है, अल्फा 2 एड्रेनर्जिक एगोनिस्ट कौन होता है, ऑपियोइड एजेंट्स कौन होते हैं, फिनोथाइजिन. तो ये आपको याद करना बहुत जरूरी है. प्लीज रिमेंबर दिस टेबल, दिस इज वेरी इंपॉर्टेंट. Now clinical uses, this is clinical uses of some these pre-medicaments. Chalazine, if you are using in case of ruminants, it causes excessive salivation, but in dog there is no such type of salivation. And even in case of ruminants, some this atropine, if you are using in case of ruminants, what will happen? Secretion, huge secretion of salivary secretion is there. When you will give this atropine, it will thicken the saliva and it may block the respiratory tract. So atropine in case of ruminants generally not recommended for this pre-anesthetic. So these are the some use of these clinical properties and uses. Increase the heart rate blockage. These are the some important uses of this atropine and xylazine and many pre-anesthetic drugs. In case of eye surgery, this atropine causes this prevent oculocardiac reflex, and this relax the urinary tract smooth muscles and causes retention. So excessive use of atropine and scopolamine may induce hallucination, excitement, and seizure. And central stimulation is not noticed after administration of glycopyrrolate, as it does not cross the blood-brain barrier. This is very important point. And this is the advantage of using this glycopyrrolate over this atropine. So undesirable, and what happens sometimes, atropine and this glycopyrrolate have some deleterious effect. So this undesirable effect, this deleterious effect of atropine and glycopyrrolate can be reversed by this neostigmine and physostigmine. So whenever in examination people used to ask that name the drug which can reverse the undesirable effect of atropine and glycopyrrolate. So this is name of this drug is neostigmine and physostigmine. Now these are the different doses of these anticholinergic drugs. So what I have discussed in this table I have mentioned there, and in that particular table I have given different classification of the drug with example. That particular example is very important. Then I have mentioned here atropine and glycopyrrolate. What are the different advantages and disadvantages? Atropine is no doubt less expensive. Tachycardia is not extreme. It is indicated in animals required quick response for bradycardia. If animal is having bradycardia, then you can administer this atropine because it is having vagolytic action, so it will increase the heart rate. And what are the different disadvantages by using this atropine? It may induce variety of arrhythmia if myocardial oxygen demand is less. IV use of cesarean section is contraindicated in beaches. So IV in case of pregnant beach, you cannot give this atropine. You cannot give. So contraindication is also very important. In which case these drugs cannot be given, because sometimes you do not know about the contraindication of anesthetics, and you are going to do, then it will have some side effect to the animals. Like in case of gelazine is having phytotoxin. If you are going to administer in for cesarean section, many times they used to have phytotoxic effect, and many times fetus will die after administration of this thiopental having same. I will discuss it later. Now glycopyrrolate, what are the advantages? This is used in less dose. This is 0.40, 0.45 mg per kg atropine. Here, this is dose of this glycopyrrolate is 0.11 mg per kg body weight. Controls bradycardia effectively. It is indicated in cesarean section as it does not cross the placental barrier and causes excessive increase in heart rates of neurons. This is the why atropine is not recommended for cesarean section and why glycopyrrolate is used for cesarean. These are the reason here, because atropine causes the atropine. Atropine cannot be given in case of pregnant beach, and why this in case glycopyrrolate is recommended, because it does not cross the placental barrier and it causes excessive increase in heart rate of newborns. And this one advantage of this glycopyrrolate is that effectively control gastric SDPS, and avoids aspiration of gastric acid secretion. Less intestinal stasis is noted in by using this glycopyrrolate. That's why this is indicated in equine anesthesia to reduce post-anesthetic polyglottivias, but this course is mainly related to dog and cats. So this point is used for equine, but glycopyrrolate is having this property because it has less intestinal stasis. So you have to remember these things. Now, thanks. Any question?